The following podcast is supported by an independent educational grant from Moderna, Inc. The following presentation is copyrighted by WebMD Education. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of WebMD Education. Disclosures for this and all episodes in this series can be found on the podcast series destination page located on education.webmd.com.
Hello, I'm Dr. Megan Pesch, Assistant Professor of Developmental and Behavioral Pediatrics at the University of Michigan Medical School in Ann Arbor, Michigan. I am also the director of our Congenital CMV Developmental Follow-Up Clinic. Welcome to our podcast today entitled Congenital CMV, Team-Based Care. It's part of our series, Let's Talk CMV. Today, joining me is Dr. Patricia Purcell. Dr. Purcell is an assistant professor of pediatric otolaryngology at C.S. Mott Children's Hospital at the University of Michigan. That's where I practice too. Dr. Purcell is passionate at bringing awareness about how to manage children who have congenital CMV, and she's also been a tremendous advocate in terms of newborn screening. We share many patients in common, so it is an extra delight to welcome her to the program today. Dr. Purcell, thank you for joining me.
Thank you for this opportunity. I'm glad to be here.
So just as a reminder for all of us about CMV or cytomegalovirus, any individual can get it at any age. It's an incredibly common virus. Around 30% of children will actually be exposed to it for the first time before they're 5 years old. And half of adults in the US end up getting it before age 40. Once someone is infected with the virus, it becomes latent and it reactivates over the course of the lifetime. Most people, unfortunately, have never heard of CMV. So this podcast series is intended to bring awareness to clinicians about CMV. I think we have been learning more and more over the past decade or so in terms of the science of this virus and more about what can be done to prevent it and treat it, especially in congenital infections. So could you just tell our listeners a little bit about what you do and how you care for children with congenital CMV?
Sure, absolutely. I'm a pediatric otolaryngologist, and as a big part of my practice, I care for children with hearing loss. And many are not aware that congenital CMV is actually the number one cause of non-inherited or non-genetic sensorineural hearing loss. Whenever a young child is diagnosed with a permanent hearing loss of an unknown etiology, I always discuss with the family the possibility of congenital CMV because many of these children will not have previously undergone testing.
Right. So for the most part in this country, newborns are not screened for CMV at birth. Can you describe congenital CMV newborn screening briefly? And then if a child or if an infant screens positive for congenital CMV, what then happens to that baby?
Absolutely. So, there is growing interest in expanding the role of newborn screening for congenital CMV. Basically, there are a few sites which have expanded to offer universal screening, which is often incorporated in the sites that perform this with newborn screening through the blood spot. The province of Ontario and the state of Minnesota are two sites that have recently adopted this approach because 90% of children who are born with congenital CMV will actually not have visible signs of viral infection at birth. And it's very important to confirm the diagnosis of congenital CMV within 21 days of birth. So it's a very short time window. And unless clinicians have a high degree of suspicion, they may not pursue that testing within that short period of time. So things to look out for, some red flags for congenital CMV would be microcephaly, petechia, infants that are small for gestational age. But again, only about 10% of children with congenital CMV will demonstrate these signs. One of the more common things that can flag a child as at risk for congenital CMV would be a referral on their newborn hearing screen. So for institutions that are not yet offering universal newborn screening for CMV, They are adopting a hearing targeted screening approach in which a child who refers on their hearing screen is then reflexively tested for congenital CMV. Now, the gold standard method of diagnosing congenital CMV is with a urine test, so urine culture or urine PCR. Obtaining a urine in a newborn can be challenging, and it involves more resources than doing, say, a saliva swab. So a number of institutions are trialing the use of saliva PCR as a more rapid means of detection, the understanding that if the saliva PCR comes back positive, they can obtain a urine and confirm the diagnosis that way. The downside to saliva PCR is that CMV can be present in a mother's breast milk. And in that case, if they're infected, it would still be an acquired infection because it would be after birth. In order to reduce that risk, the recommendation is if a saliva swab is obtained, it should not be close to breastfeeding. There should be a delay.
That's super helpful. Testing of CMV, it is very nuanced. So thanks for going through that. After a newborn is confirmed as having congenital CMV, kind of what generally happens next? Can you describe kind of a more general course of care? I know lots of areas can be affected, so it's going to be different for every kid. But generally, what kind of care do these children usually get right away in that newborn period?
Definitely. I think it's really important to remember that the severity of the disease process is very much on a spectrum. And so the treatment will need to be tailored to each individual child in some ways. Children who have symptomatic CMV may require intensive care after birth. They may require neurological consultation for seizure or cerebral palsy type symptoms. There are options once the diagnosis is confirmed for consideration of antiviral treatment for those children. Children who are on the other end of the spectrum, who are asymptomatic, may not be diagnosed until they show up in a otolaryngology clinic at the age of 4 or 5 with a newly diagnosed hearing loss and maybe some mild speech and language delay. So there's definitely going to be differences in what supportive therapies are needed in those different situations. For families that are facing a diagnosis of congenital CMV, it's really important for there to be an identified point person, whether that's a pediatrician or a family medicine physician who is somewhat familiar with congenital CMV or willing to learn about it.
Exactly. I think the whole team approach is super important, and having a point person for that team just keeps everybody coordinated. 2 questions. How do you generally encounter infants with congenital CMV? And 2, who are the other key players in the healthcare team taking care of a newborn recently diagnosed with congenital CMV?
So my typical point of contact may be an audiologist who has diagnosed a child with via sensory neural hearing loss. Whenever a child presents with that, there's no etiology that's been identified, I always include congenital CMV in the discussion. The testing that we pursue at that point will kind of depend upon the age of the child. But the approach will, be about counseling on the importance of monitoring hearing over time, because children with congenital CMV may initially present to their ENT provider with a mild hearing loss, but that is at risk of progressing over time. As a cochlear implant surgeon, I have a number of patients who I have seen progress from mild sensory neural hearing loss all the way to profound and candidate for bilateral cochlear implants. In addition, as an otolaryngologist, I also participate in the care of children who have vestibular balance disorders, and children who have CMV are at higher risk for these conditions as part of a overall physical therapy plan, vestibular physical therapy can be very useful. And I am just but one member of the CMV healthcare team. I work very closely with audiology because they're the ones who are seeing the kids back in the sound booth on a very regular basis. Congenital CMV has been designated as a risk factor for hearing loss, and even children who have a normal hearing screen at birth should be closely monitored, particularly over the first 5 years of life. Other important members of the team, I would start at the beginning. When a woman first meets with her OBGYN provider, it's the hope that congenital CMV would be included as part of the counseling for an approach to a healthy pregnancy. Because if we can prevent congenital CMV before it starts, then that's really the best case scenario. And we know that congenital CMV is typically acquired through exposure to bodily fluids containing the virus. This often happens in young families where there's a toddler at home who has picked up CMV from a childcare setting, and then it is possible for a pregnant mother to contract it. I think really the healthcare team starts before the baby's even born. And during the pregnancy, it's important to monitor for any concerning symptoms that could be associated with congenital CMV so that testing can be performed very quickly, because that 21-day window will close pretty rapidly. I think it's important to have a point person, a pediatrician or a family medicine provider who is familiar with the presentation of congenital CMV and what to look for and when to reach out for support. Once a child is confirmed to have congenital CMV, there are other specialists who can provide useful opinions, such as a pediatric infectious disease specialist regarding the role of antiviral treatment for that particular child. We also want to remember that congenital CMV is associated with CMV retinitis. These children are at risk of visual defects, and so they should be monitored by ophthalmology as well. Additional supportive therapies can be useful, such as physical therapy, occupational therapy, and speech language pathology, depending on the particular child's needs. For children who have significant therapy needs, the physical medicine and rehabilitation specialists should be involved in their care. And of course, developmental behavioral pediatrics play an important role in making sure that children are proceeding along appropriate development neurocognitively and monitoring for any other conditions such as autism spectrum disorder, which may be more likely in children who have congenital CMV.
I want to actually take a step back and just ask, what happens if a patient isn't born in a major urban center where they have a children's hospital and all these specialists? What happens if a patient doesn't have access to all this specialized care? What advice would you give families?
So I think it's important to take advantage of some of the options for virtual care delivery that are available now. Families that are facing diagnoses that are not particularly common are finding it easier to make connections with centers that specialize in those conditions through these portals of care. There's also expanding use of social networks, connections within the community, which can provide not only access to healthcare, but also social supports. There are some really great websites that provide information. The Centers for Disease Control and Prevention, cdc.gov, has a plethora of information about congenital CMV with some resources available. The National CMV Foundation, which is a nonprofit organization, has a number of resources available at nationalcmv.org.
I think that telehealth or these virtual appointments is a silver lining of the pandemic. I look at children's development and their behavior, and they act a lot more typical when I'm watching them in their own home than in my office. I wanted to bring us back to the parent experience. Before I shifted my care to congenital CMV, I just did general developmental pediatrics. And 3.5 years ago, my third daughter was born with severe symptomatic congenital CMV. At that time, I didn't know much about CMV, either as a clinician or just as a new mom. So I found myself as a parent being overwhelmed. A lot of us clinicians haven't had the best education or exposure to congenital CMV in our medical teaching. From your perspective, what do you see as being a parent's biggest challenges when it comes to managing the healthcare needs of a child with congenital CMV? I want to hear kind of your opinion first, and then I'm happy to tell you a bit about my experience.
I really appreciate you sharing that with our listeners, because I think it is so important to have that perspective. Because as a provider who cares for children and families affected by congenital CMV, the thing that stands out to me is just all of the questions about what is my child's particular journey going to look like, and how that can be difficult to predict, because it is a diagnosis that has a lot of variability in terms of where children end up. And of course, our goal is for every child with congenital CMV to thrive in their own individual way. But I think trying to navigate all of the specialists can be hard. For example, if you aren't sure if your child is going to need a physical therapist or an occupational therapist or a speech language pathologist, how do all of these pieces fit together for my family? It can be a lot of information, a lot of overload at the beginning, but I would love to hear your perspective on this topic.
The feeling of being overwhelmed definitely resonates with me. Also, just like you said, the unknown. As soon as my daughter was diagnosed, I got on Google. I did the thing that we tell our patients not to do. I read up to date, and then I got on social media. I was able to connect with individual families and have conversations, find kids and families that seemed similar to mine. So that was really helpful for me to see how their kids were doing a little bit further into their journey. I actually warn my patients about this. There are some groups on Facebook. They're wonderful, actually. There actually can be a huge, huge help and resource. Some of them to have children who are perhaps more severely affected. And I think it's important to know that, yes, kids can be severely affected, but that's not most kids. So go into connecting with those other families or resources, knowing that everyone's journey is different. Because I don't want people to get scared away from learning about CMV. It is so hard to know, especially like early on, because you're just looking at this baby who, for the most part, looks perfect. One of the things about CMV that is so hard is that you look at these kids and you can't tell the silent or invisible disabilities. That was really tough for me because I felt like my baby was sick, but also when people looked at her, they just saw her chubby little cheeks and her dimples. That was hard, but also wonderful at the same time. So I don't know. That's just kind of like motherhood, I guess. It's like a mixed bag, lots of feelings. For me, it was helpful to write things down, to kind of prepare my questions in advance for our subspecialists. I often, I have like a million questions, but I would have to write my top 3 and make sure I got those top 3 answered. I think self-care is super important for parents, and it's something that a lot of us aren't necessarily very good at. I think knowing what you need personally and when to reach out for help when you're feeling overwhelmed. Everyone's journey is different. That's just my own personal experiences, but I think connecting with other people who have walked this journey or walked this road and really taking care of yourself as the parent. Wow.
Thank you for sharing that. I think our listeners will appreciate hearing that perspective.
Oh, thanks. Dr. Purcell, this has been a very jam-packed 15 minutes. We've crammed a lot of information in. So I really appreciate you sharing your expertise and passion about congenital CMV screening and management. I thank you for sharing it with me and our listeners. It was a really great discussion.
Thank you for inviting me to be here.